Hello, this is Dr. Tony Clark with learninganesthesia.com, and today we're going to talk about maintenance of anesthesia and a quick rundown of things you can check and think about while you're in maintenance phase of anesthesia. And this is typically what I do when I'm sitting in a room. So first thing I go through is A for airway. I look at the airway, whether it's an endotracheal tube, an LMA, and I see that it's in the correct position. Are there bilateral breath sounds? If the patient does not have an invasive airway, are they maintaining their airway appropriately? And I make sure the circuit is completely connected to the airway and the patient is receiving adequate oxygenation and ventilation. B is for breathing. Which really I'm trying to emphasize here is ventilation. So how do you appropriately set the ventilator for a patient? Typically, you set their tidal volumes to 4 to 6 cc's per kilogram of ideal body weight. But how do you calculate ideal body weight? Well, for a 5-foot male, the ideal body weight is 50 kilos. For a 5-foot female, the ideal body weight is 45 kilos. For each one, irrespective of their gender, you add 2.3 kilos for every inch greater than 5 feet. Therefore, if a male was 5'1", he would be an ideal body weight of 52.3 kilos. For a female, if she was 5'1", she would be 47.3 kilos would be her ideal body weight. So irrespective of the gender, 2.3 kilos for every inch above 5 foot. At males, you start with 50 kilos. At females, you start with 45 kilos. The other thing when I check breathing, again, make sure the circuit's all connected appropriately, that your end-tidal CO2 is appropriate for the patient. And the other thing I check is I check for the absorbent. Make sure it's not desiccated. C, I check for circulation. Remember, mean arterial pressure equals cardiac output times systemic vascular resistance. Cardiac output is based on heart rate, stroke volume, which essentially is preload afterload and contractility. The other thing I look at is the rhythm of the EKG. Is there any abnormalities or any ST changes? Ideally, you should keep mean arterial pressures within 20% of baseline. And remember, cerebral autoregulation is maintained between maps of about 50 to 150. Some people say 60. D stands for depth of anesthesia. And I'm also going to say depth of your neuromuscular blocker when appropriate. Is it appropriate for the patient's condition? E stands for emergence. Do you have your drugs drawn up and ready for emergence? Are you moving towards emergence, and what is your plan for emergence? The other thing with E is emergencies. Are you prepared for the most common emergencies that can happen with this case? And do you have a plan for each one? Such as venous air embolism, pneumothorax, or massive bleeding. On the note of bleeding, how do you know if, without checking labs, that you may want to start transfusing a patient? Well, there's always the hemodynamic parameters. The patient's blood pressure goes low and their heart rate goes up. That's something that might indicate that they're becoming hemodynamically unstable. But one thing you can quantitatively use is your allowable blood loss, which equals your hematocrit initial minus the hematocrit at which you want to start to transfuse, divided by your hematocrit initial, multiplied times your estimated blood volume. That gives you the amount of allowable blood loss before you would want to start to transfuse. How do you calculate the estimated blood volume of a patient? We'll go down a list. Neonates, infant, child, adult, female, adult, adult female, and adult male. The estimated blood volume for neonates is 100 cc's per kilogram. For infants, it's 90 cc's per kilogram. For a child, it's 80 cc's per kilogram. For an adult female, it's 65 cc's per kilogram. For an adult male, it's 70 cc's per kilogram. So essentially, it's 10, 90, 80, and then 65 for female, 70 for a male. That's how you calculate your allowable blood loss. So these are the things that I typically do when I come into a room, or I'm taking over a case, or when I'm sitting there with nothing to think about. It's good to go through these things. That way you're not caught off guard. Hope you enjoy.